So I'd absolutely like to welcome everybody to our webinar today. The title here is Get the Facts on the Label. We just have opened up the webinar to our participants, so we'll give everybody a few minutes just to get in. We had a very good response to our call today, so plenty plus people coming in. So when we're all in, I'll get going. We'll make some introductions as well. I'd like to very warmly welcome everybody who's still making their way in through the Zoom portal. We're just going to get going in about a minute or so. I see still plenty of people actually entering. We'll just take a wee minute and I'll get the thing started when you're all in. Okay, so I think we'll get going. My name is Sheila Gilheeney. I'm CEO of Alcohol Action Ireland, and I want to welcome you very warmly to our event here today, Get the Facts on the Label. And we're going to be talking about Ireland's labelling regulations for alcohol. And I'd like actually to begin, first of all, by making some introductions. Professor Frank Murray is our chairperson, and I'm going to hand over to you, Frank, now just in a minute. We're going to be looking at three separate areas of the labelling regulations. We're going to have our first talk is going to be from, from Professor John Ryan at Beaumont Hospital, who'll be talking about liver disease. Anne Doyle is going to be talking about the link between breast cancer and alcohol use. Anne is based at the Health Research Board and has done some research recently on this area. Then we're going to head all the way over to Australia, to the CEO of FARE, and that's Katerina Georgi. And in Australia, there was an awful lot of work done over many years in order to make sure that there were visible pregnancy health warnings available on alcohol products. So we're always very interested to hear what's going on in other countries. And then we'll round up with a panel discussion, and we will be joined, as well as our speakers, we'll also be joined by Katie Dunphy, who's from the HSE Alcohol Programme, and from Rachel Morrow, who is Director of Advocacy and External Affairs at the Irish Cancer Society, and a body who really worked so hard actually to make sure that we would have these labels on our alcohol products. So, Frank, if it's okay with you, I think actually we'll get going if you're happy enough there. And
yeah.
Yeah.
Thank you very much indeed. Sorry, big part. Thank you very much indeed, Sheila, and thank you very much to Sheila and the team in Alcohol Action Ireland for organising this afternoon's event. And you know, I think when we think about labelling in terms of alcohol and the dangers of alcohol, around the three topics that we're going to discuss, liver disease, cancers, and pregnancy, there's absolutely unequivocal evidence that alcohol causes all of these harms. And to me, the mystery is, why does this product, which is sold freely in retail, not have labels? It's more a mystery to me why they don't have labels rather than why we're only introducing them now. And that really, to me, is the most important thing that we need to think about as we look towards the implementation of these labels, I hope by the Department of Health quite soon, as Sheila has already outlined. Labelling legislation was passed in 2018, and it's gone through a number of processes, including the EU and the World Trade Organization, where it's not quite finished. But I think we're almost there, and I look forward very much to consumers and citizens having their right to accurate information being recognized with the delivery of warning labels on alcohol products. So I think it's really important we think about that. As Sheila said, we're going to have, Sheila's going to introduce the meeting, and after that then we'll have a presentation from John Ryan on liver disease, breast cancer awareness from Anne Doyle, and then visible pregnancy from labels in Australia from Katerina Georgi. So I look forward very much to these three presentations. I'll start by asking Sheila first to address the issue of setting the scene for Ireland's alcohol labelling regulations. And many of you will know Sheila already. She's the CEO of Alcohol Action Ireland, where she's been in that role since 2019. She has a previous role in leadership in other not-for-profit organisations prior to joining Alcohol Action Ireland, and she's involved in a number of European boards related to alcohol advocacy. Sheila is a physicist at heart. She's got a primary degree and a PhD in astrophysics, no less. So Sheila, I'm looking forward to hearing your setting the scene. Thank you.
Thanks very much, Frank. And Frank, I should have said, of course, is actually the chair of Alcohol Action Ireland and a liver specialist himself. So what we're here to talk about is the whole process that has been behind getting labels onto alcohol products. Now, just as a quick kind of reminder for ourselves, we're an advocacy and policy group. We research the policy solutions that we hope will actually bring about change in the level of alcohol harm that is experienced here in Ireland. And of course, it'll come as no surprise to anybody who's attending here. We do have very high use of alcohol here in Ireland. We did a calculation just earlier in the year, and we know that per drinker in Ireland, we're drinking something like 12 bottles of gin a day per drinker, plus 277 cans of beer, plus 39 bottles of wine, plus 36 cans of cider. And none of those bottles or cans have any sort of health information actually on them. What's the end result of that level of alcohol use in the country? Well, we have many, many different statistics that we could use, but I've just put 4 of them up there, but really I could put up another 44. 15% of the population would have an alcohol use disorder. We have 4 deaths every single day. I find that particular statistic absolutely terrible. 4 deaths every single day. 11% of our healthcare budget goes into trying to address some of the problems here. And we know that the cost, the wider cost, is of the order of 3.7 billion, but actually is probably maybe twice that amount if we fully included harm to others that would arise there. So in order to address all of these problems, some years back ago, there was legislation put forward. It was the Public Health Alcohol Act. It was passed in 2018. It actually took 3 years, though, to get through the Oireachtas, get through our process in our parliamentary process. And within that act, very much what was being put forward were the WHO best buys around alcohol controls. So we know that what works is controls on pricing, on advertising, and on availability. So the measures that were within the Act, and you'll see there's several of them have already been implemented, the ones that are listed there in green. We have prohibition on advertising in particular places, some restrictions on advertising during events. We have prohibitions on advertising children's clothing and advertising cinemas. There's also a whole thing about structural separation in shops, so that when you go into a shop, that you shouldn't actually see alcohol immediately in front of you, that there should be a separation around that. There's also minimum unit pricing, which would have come into place last year. There's also regulation about the sale and supply of alcohol products. So things like, for example, that you shouldn't get 2 for the price of 1, or bonus points on club cards that might be used in supermarkets. And there's also some restrictions or some means by which, if you're applying for a license to sell alcohol, that you also have to inform the HSE, the Health Service Executive, about it. So those are all provisions that are there, and those have been implemented. What's still outstanding is just labelled there, some more restrictions on advertising. But the one that we're here to talk about today is the labelling of alcohol products. Now, if you were to listen to the industry about that, you would hear really very excitable voices talking about, thundering disgrace type thing, and, really very outrageous comments being made about them. But as you can see, the labels themselves, firstly, they're fairly small, they're text-based, and I'll just actually go in a close-up there that you can see it. There's the warnings are around 3 specific areas. You can see a a warning about that alcohol causes liver disease, that there's a direct link between alcohol and fatal cancers, a warning about drinking in pregnancy, and a bit of other information like as in the number of grams of alcohol that's within the product, and the number of calories, the energy value of the product per can or bottle, whatever it is that you would have. And there's also a link to a public health information site, Ask About Alcohol. And in fact, we have Katie Dunphy here from the HSE alcohol programme, and they are the people who actually look after that website. So a lot of furore about all of these labellings and how do we get there. So although we have the legislation that has been passed in law back in 2018 in our own parliament, because we're part of the European single market, we also have to go through an EU process around that. And I want to just give a little bit of context here and kind of an explanation of what the picture is in Europe about this. So the first thing I think to really note is that there's actually no harmonising legislation in the EU in relation to health warnings for alcohol. What we know at the moment is that in 2011, there were regulations that were introduced at that stage that said for basically every other product that you might buy or consume, that there would be regulations about needing to have a listing of the ingredients in the product, and also nutritional info, like as in, you know, how many calories, that kind of information. But alcohol, because remember, it is no ordinary product, it actually has an exemption from that. And so it is the only product that's for sale in the EU that you might consume that doesn't give you any information at all in that regard. There have been various attempts around self-regulation, and funny enough, they're all entirely unsatisfactory, and it really has come to nothing. So what there is within the European context is that there's right now a proposal that the 2011 regulations should be amended so that alcohol would have to comply. And that's just to give that very basic information about nutrition and ingredient. There's strenuous effort from the industry to have that information be provided off-label. So in other words, if you lifted up your can of whatever, that you wouldn't see it on the can, you would actually have to go to a website to find it. Now, in parallel, alongside those developments, there is also the EU, the Europe Beating Cancer Plan, which was published in 2021. And within that, there's a call for cancer warning labelling to be introduced by the end of 2023. So where does Ireland's regulations kind of fit into all of that? Well, the legal process is that back in 2018, when this law was going through the Oireachtas, what had to be done at that stage was to inform the Commission about Ireland's plans to introduce some form of labelling. And at that point, Member States had an opportunity to comment. So as I say, the legislation was passed back in October 2018. But then what was then needed was detailed information about, well, what exactly would these labels look like? And that wasn't published until June 2022. And at that point, it had to go back to Europe again. And there was a standstill period during which time stakeholders could comment. And that standstill period came in December 2022. Now, you might kind of wonder, well, how can Ireland do any of this at all? Have we not just said that there's a derogation, that alcohol doesn't have to do anything about labelling? Well, within that 2011 European legislation, there is a proviso that says, actually, if a member state wants to go their own way in terms of giving health information, they can do so. And so that's exactly what has been done. Now, we know that in that consultation period, there was a lot of talk, and from industry, there was an awful lot of bluster, as I think is how I might describe it. But actually, of the submissions that were received, 70% of them were in favour of having this legislation or having these regulations. And actually, that's very much in line with the public support of what we see is actually here in Ireland. The public do want this, and as I say, it was something that was passed by the Dáil. So where we're at the moment, we came to the end of that standstill period at the end of December, and the EU made no response. But that is entirely consistent with what we knew would be the case, because the regulation provides that member states can adopt whatever they want to say about health, provided that they notify the Commission in advance and that they show that this response, this label, this type of regulation, that it is proportionate to the level of problem that is actually being experienced. So it's a recognition really that member states have a competency to adopt a measure on the grounds of the protection of public health. Although the Commission didn't actually issue any comment, which, as I say, was in keeping, we do also know, though, that the European Commissioner for Health and Food Safety, Stella Kyriakides, actually made it very clear that Ireland's regulations were entirely in keeping with the single market regulations that are there. So back in March 2023, I just have a statement there that she would have made, and this was an answer to a parliamentary question that came up within the European Parliament. And she just, says it quite clearly. The Irish authorities demonstrated that the notified measures were justified on public health grounds, considering the situation in Ireland, and that any resulting restrictions for the internal market, well, they were proportionate to that objective, the objective being pursued. So that's where we stand with Europe. There is a wider context again, because we trade within the world. So another step that had to be taken was that the Irish government would have to inform the World Trade Organization again about these regulations. So that, and this is really like if you like, it's a process to make sure that all countries know what we're doing, so that a manufacturer in South America or wherever will know, if you're going to trade, if you want to actually send something to Ireland, this is what's actually going to be required. So the process what happens there is that in February, they were notified. Again, there was a standstill period until the 7th of May. We understand that there have been a number of objections by member states, not surprising. We see reports in the media that this is maybe about 9, which is a relatively small number when you consider how many nation states there are actually in the world. Our understanding is that on June 21st, there will be a meeting of the World Trade Organization, of a particular committee who look at this. It'll be discussed there. And our understanding is that the EU actually has a role in defending Ireland's position at that meeting. Obviously, Ireland would be, feeding into the European Commission and, of their understanding of the objections that maybe have been made. What we know and what happened yesterday and what we heard about is that the industry are not taking any of this lying down. They have just issued a complaint to the EU. To some extent, this is not a surprise, but it's actually not a part of the legal process that's actually around these labelling. Anyone can make a complaint. I could make a complaint myself tomorrow. It doesn't necessarily mean that it will actually derail the regulations as they are. So, not surprisingly, you can see sort of the names of the people who have been making the complaint. We understand that there's a 2-week window for the Commission to acknowledge the complaint has been received, but that there's no actual formal timing for any possible action after that. What we also know is that the Minister, that there was a statement would have come out from the Department of Health that the Minister will give consideration to the commencement of the laws once all the various obligations have been met. I will say that we did meet with the Minister for Health last week, and I have to say, and Frank was at this meeting as well, we were left in absolutely no doubt as to the Minister's total commitment to these labelling regulations. And I really do feel that this is something that is going to happen. We'll get through, Ireland will work its way through, the legal process that are there, but I am absolutely certain that there is, a complete commitment to making sure that these labels will appear on the bottles, and the consumer's right to be aware of the risks from drinking alcohol will be vindicated. Okay, so that's me. That's just hopefully just setting the scene for what we're going to hear from our speakers now about the actual risks and the various problems that the reasoning behind why we want to put forward these labels in the first place. Thanks very much.
Thank you very much indeed, Sheila, for setting the scene so nicely, and really it leads pretty much directly, I think, into our next presentation, which is from Professor John Ryan, who's a consultant hepatologist in Beaumont Hospital and an honorary associate professor in RCSI. John is a hepatologist, so he's right on the front line, dealing with patients who are coming in with liver failure from all causes. But as we know, in Europe, about half of deaths related to liver disease are due to alcohol. So John and his team and his colleagues have enormous experience in dealing with this and have been pursuing a research program in relation to this. So John, it's a great pleasure to ask you to address the issue of a rising tide of liver disease. Thanks very much indeed, John.
Thanks. Thank you, Frank, and thank you, Sheila. I want to share my slides. We'll just take a second. Should work. Can you see that okay? Okay, so I'm not really going to, hold back. I think that this is an opportunity for people who aren't on the front line to realize what the front line looks like and why we are where we are and why urgent change is needed. So I'll just going to be very honest about how I see liver disease in Ireland, or how it is, the local experience that we experience day to day, the trends that are affecting liver disease in Ireland, and I think it's important to offer maybe some solutions. So what's going on in the front line, in Beaumont Hospital? So, yesterday we have a liver meeting every week. I sat down and looked through the last month of our workload on the wards. Who's coming into hospital with alcohol-related liver disease, and how severe is it? And the liver element is not the only reason why you might come into hospital. I haven't really touched on other forms of alcohol harm, but part of that alcohol service that I chair, we've identified that maybe 1 in 5 people presenting to the emergency department in Beaumont Hospital come for an alcohol-related problem. And another line that I like saying is that during the pandemic, there were as many admissions to our intensive care unit for alcohol as there were for COVID-19. And Beaumont was one of the busiest ICUs in the country. So that puts things in perspective. So in the last month alone, there were 23 admissions for severe liver disease, and 87% of them were alcohol related. I had a young woman, aged 30, and the age range was up to 68 of those people with severe liver disease. So severe liver disease means cirrhosis, severe alcohol-related hepatitis. These patients tend to stay quite long in hospital, and up to 6 weeks. It involved emergency procedures for gastrointestinal hemorrhage in 7 patients who needed emergency endoscopy performed to stop them bleeding to save them. 5 of the patients needed critical care assessments, that's intensive care involvement. 2 patients died, and that's important because unfortunately, this type of issue brings severe tragedy and trauma, and what we see regularly is young people dying of severe liver disease. People in their 30s, people in their 40s have died under my care recently, and these are people who have families, who are active professionals, who have jobs, who are not as people imagine, the down and out on the side of the road. These are people who actually are just normal people. And then liver disease brings with it irreversible liver damage that sometimes has no other option, and for medical care, and often palliative care are involved, and that's something that is something that we involve often. So what happens when these people come in? This is the kind of thing that we see day to day, and this is the kind of thing that it really brings it home. People hemorrhaging from gastrointestinal varices. This is on the left. This is a procedure we perform quite regularly to stop this bleeding, where people at home might start vomiting blood spontaneously, and that's maybe their first sign that they actually have liver disease, which up until then has been asymptomatic. And this is an emergency, it's life-threatening, but this is the kind of thing we have to do to deal with the harms related to alcohol related liver disease. And then in the middle, You know, this is the typical kind of patient you might see, a woman or a man, as I say, even in their 30s, late 20s, 40s, who come in, they've very little muscle mass, their abdomen is full of fluid from liver failure, and they're yellow or jaundiced from liver failure. And then, you know, this can progress. They are very weak, and that's why they end up in hospital for so long, draining a huge amount on hospital resources and personnel so that they can recover and get better. And then a lot of patients end up in intensive care, and that's where, again, options are limited, but they can be severely unwell and need to be ventilated to get them through, or not, or they may pass away. And that's just the reality of it. I know it's quite stark, and you just had your lunch, and you know, but I think that that's what we're dealing with, and we need to be really open about it. What are the trends like in Ireland for liver disease? So, you know, the UK is very useful to look at because we have very similar trends and similar issues with alcohol. This is a slide that we often show, and this is mortality related to liver disease over the past since 1970 in the UK. And this line that increases clearly and is an outlier compared to all other diseases such as breast cancer, stroke, heart disease, and lung disease, which have all experienced improvements in medical care and improvements in outcome. Liver disease has been left behind, and its mortality has increased significantly over that time. And it really sets out where it's been missed. And these are the figures now. It's the third leading cause of premature death in the UK. It's the leading cause of death in 35 to 49-year-olds in the UK. And liver disease is the second leading cause of years of working life lost in adults, you know, because it drains people so much, the comorbidities that they have from alcohol-related liver disease. And it's more to say that not all liver disease is alcohol-related, but when you're at this severe end, 90% of these deaths are alcohol-related. And it is really alcohol, which is the main driver of death from liver disease that we see. So what about Ireland? You can get similar figures from a WHO platform, and that shows a similar pattern of increasing mortality in Ireland related to chronic liver disease and cirrhosis since the 70s. So it's a similar figure. You know, as others will say, the number of alcohol-related admissions and for liver disease in particular has increased substantially over the past few decades. And this is a kind of a similar pattern, which can then is read out as a higher rate of mortality. And similarly, these patients tend to stay long in hospital compared to patients who have non-alcohol related issues. And similarly, if you have cirrhosis or liver disease or cirrhosis, you're at a higher risk of liver cancer. And the figures from Ireland again show a rising incidence and a rising mortality related to liver cancer. And that's a cancer that if you screened someone at risk, detected cirrhosis, which is the main risk, you could implement a screening program which has been shown to reduce mortality, where you pick the cancer up earlier at a curable stage, whereas most patients now are picked up at a much more advanced stage, like stage 4, where they can't be cured, as opposed to stage 1, where it is curable. So these are the figures from Ireland. Over 450% increase in liver disease mortality in Ireland, over 200% increase in hospital admissions for liver disease in Ireland, and an over 300% increase in liver cancer incidence in Ireland. You know, and other studies which are interesting, which show that there's a 30% increase in death from alcohol-related liver disease in hospital over since the 90s. That's a really startling figure. And similarly, if you look at intensive care, so the people who got into intensive care, it's almost a 50-50 chance of surviving. Some intensive cares, the mortality with liver disease is 80% or more. You know, so once they're that sick and they get into intensive care, unfortunately for patients, you've very, very poor outcomes. What happened with COVID-19? This is from the UK, and this is Audit C, which is a screening tool for how much people are drinking and at risk. And you see everything jumps up. You know, everyone remembers around St. Patrick's Day that suddenly when the first wave hit, the pubs closed and everything else, but sales of alcohol at home increased significantly, and the drinking patterns, you know, worsened for a large proportion of people at that time. And interestingly, they still haven't settled back down to normal. So what came with that? Well, across the world, And what we found in Beaumont, that there was an increase in alcohol-related liver disease at 30% at that time. And there was many factors around that. Women seem to be disproportionately affected. And even like in the US, in the UK, it was really similar patterns of significant increases in alcohol-related liver disease because of this sudden spike in alcohol consumption. And then nice data from the UK again, just showing similar patterns of deaths related to alcohol from dependence, from liver disease, from drug and alcohol poisoning and suicide. Well, certainly liver disease is the focus of this talk, and you can see that it did increase from COVID-19 time onwards, so the pandemic, and that is driven by alcohol, there's no doubt about it. And this is slightly harder to visualize. The green ticks at the top are just this spike. The trends over time are the little tails, and then it suddenly spikes up, and that's around the time of COVID, that the deaths from liver disease, deaths from alcohol dependence, they all seem to spike around that time, particularly in 35 to 44, 45 to 54, and 55 to 64-year-olds. So these are all working, adults. So in summary, in Ireland, there is a definite and significant and increasing burden of alcohol-related liver disease. Young adults are affected in particular. There's a rising rate of mortality from liver disease and liver cancer. It was definitely made worse by COVID, and there's definitely a significant financial implications to the HSE and the Department of Health. What do I think, how could we solve this? There's three things, three slides. We need to address the alcohol crisis and not push it under the carpet. We know that over half the population who drink in Ireland drink harmfully. Why is this? I'm sure it's going to be covered, that with alcohol is widely available and affordable. We know that there is relentless promotion of products, and whether you can acknowledge it or not. And like this graph here from the HRB just shows that everyone who drinks knows that it's harming their liver or could harm their liver. Over 90% of people who responded to a survey said that the liver would be affected by excess alcohol. But there's a real stigma about it, trying to look for help. Patients do not want to go to their GP, look for support, talk to their families. They're really isolated, and that propagates everything else and, continues the cycle of alcohol misuse. And that's something that we need to address. The service is an issue. Liver disease has been under-resourced. And this is a study from Ireland. There was 30,000 patients. Their admissions were assessed. Only a third were seen by a liver specialist who was trained. And that's because a few years ago, there was only about 9 or 10 liver specialists in the country who'd been trained. So there was really an absence of specialist services. Most of them are in Dublin. So you worry about what happens if you're sick elsewhere. You don't get the same care, and the outcomes then are different. And that's a real problem. And that means that the mortality is going to vary across the country. And again, that was the reason for a charity we set up called the Irish Liver Foundation, where we're promoting, advocating for a change in that strongly. And then finally, just obviously, if the solution is to implement what was outlined in the Public Health Alcohol Act or Bill, and we see from the UK, from Scotland, now we see this data coming out from minimum unit pricing that there have been significant improvements, say 11% reduction in death and 10% reduction in hospitalizations for alcohol-related liver disease. And this is something that, yes, we've put MUP in. I've no doubt that it will bear fruit, but it's really part of the package that we need to implement to have a positive effect. So these are the solutions that I think that are critical to improving liver disease in Ireland. And so just to conclude, there's a definite crisis. You can't deny it. I don't think there's any counter argument to bring in labeling or any measure that might improve or reduce the harm associated with alcohol. And I'm strongly in support of it. Thanks very much.
Thank you very much indeed, John, for a wonderful presentation and for setting the scene very well from a liver point of view. And indeed, it's an immensely grim picture you paint, I think, isn't it? And it was my own experience as well, very much in relation to that. A terrible harvest of young people who fell victim to alcohol-related liver disease, and a dreadful way of dying too, often a long period in the intensive care unit or palliative care, so, which was often prolonged as well. So thank you very much, John, for presenting a very clear picture in relation to that, and for coming up, for presenting some solutions as well. We're going to address questions at the end when we have the panel discussion, I think, rather than have them after each presentation. But you can submit your questions, and Jennifer will happily collate them and prioritize those for the end of the towards the end of the meeting. So thank you very much indeed, John, again. Our next presentation comes from Anne Doyle from the Health Research Board, and Anne is well known again to many of you. She is research officer at the HRB, where she collates information about alcohol use and its related harms in alcohol in Ireland. So she's again somebody very, very familiar with the sort of issues that John has outlined there, and the broader issues indeed as well, particularly cancer and other harms. She describes herself as being passionate about promoting the use of this evidence to influence policy and practice to help reduce alcohol harm. So she's certainly in the right place in relation to that. And of course, what we're trying to do is to propose the use of evidence-based practice. So Anne is going to talk to us about awareness of breast cancer risk among people in Ireland. We look forward very much to hearing your findings, Anne. Thank you.
Thank you, Frank. Can you see my slides?
Yep, thank you.
Great. So thank you for that, Frank, and thank you to Alcohol Action for inviting me to this important event. I'm going to talk to you today about a paper that my colleagues and I had published a couple of weeks ago, where we looked at the awareness of the risk associated with alcohol use and the increased risk of developing breast cancer. So I'm just going to talk you through our aims, our methods, and our results and conclusions and some recommendations. And before I begin, just to declare that I have no conflict of interest. So a little bit about alcohol and breast cancer globally. We know that about 4% of all new cases of cancer are attributable to alcohol use. Female breast cancer is the third most common cancer attributable to alcohol. And back in 2008, exceeding the low-risk drinking guidelines was a key risk factor for alcohol-attributable cancers. But since then, the WHO, the World Health Organization, have now advised that there's no safe level of alcohol use. I've just included a couple of the literature that looks at alcohol and breast cancer. And for example, less than 20 grams of alcohol per day, which is the equivalent of 2 standard drinks, contributes to 1 in 7 alcohol attributable cancer cases. 5 to 10 grams, which is half a standard drink, a very small amount, to 1 standard drink is associated with breast cancer, and the risk increases with episodes of binge drinking. And 1.5 standard drinks to 3 standard drinks per day is associated with a 35% increase in breast cancer risk. In terms of Ireland, breast cancer is the third most commonly occurring cancer, but the most common among Irish women. There's about 3,700 new cases diagnosed every year, and alcohol is attributable to at least 260 of these, or the equivalent of about 7% of our breast cancer cases. And up to 700 people die every year in Ireland from breast cancer. And in 2017, there was about 10,700 discharges from Irish hospitals due to alcohol-related cancers. And of these, 29% were breast cancer discharges. So you'll be familiar with these graphics, but we, as you know, we have a high level of per capita alcohol use. We have a high level of monthly binge drinking. We are ranked 9th among OECD countries for our level of alcohol use. And particularly among women, we know that from the Healthy Ireland survey that about 3/4 of women in Ireland drink alcohol, about half of women drink alcohol weekly, and 19% binge drink on a typical drinking occasion. So for this particular study, we used the Healthy Ireland survey. And anyone not familiar with the Healthy Ireland survey, it's a nationally represented survey, cross-sectional survey of adults aged 15 years or over. It's carried out every year and includes roughly about 7,500 respondents. And it includes questions on a variety of topics, including smoking, alcohol use, diet, physical activity, sexual health, general health, mental health, and health service utilization. And every year there are a few core alcohol questions asked, but every once in a while they include some additional questions. And that's what happened in wave 2 of the Healthy Ireland survey. So in that particular wave, respondents were shown a show card with a list of health conditions, and they were asked to identify which of the health conditions listed they thought that they were at an increased risk of developing. if they exceeded the HSE low-risk alcohol guidelines. So they were given a list with bowel cancer, skin cancer, breast cancer, high blood pressure, stomach ulcers, pancreatitis, and liver disease. And skin cancer was kind of thrown in there as a red herring because they wanted people to really consider each of the conditions, but skin cancer is not associated with alcohol use. Respondents were shown then a picture of what a standard drink equates to. And this is a graphic from a paper that was published in DrugNet by my colleagues that looked in particular at the information from that question. And you can see, and John also had this in his, but you can see that, as John said, good awareness of the risk of liver disease, but fairly poor awareness overall for the other health conditions. And lowest of all was the awareness of the link between alcohol use and breast cancer at 21%. So what our paper was aimed to do then was to investigate the level of public knowledge of the association between alcohol use and the risk of developing breast cancer, and to look at the characteristics related to the level of or the awareness. This was published, as I say, back in March this year in BMC Public Health. And as we know, just 21% are aware of the risk between alcohol and breast cancer. This figure here just pulls out some of the main findings, and we can see that females were statistically significantly more likely to know of the risk, but you can see here that the yellow bar represents those who were aware of the risk associated with alcohol, and you can see that across the board it is fairly low. So females were more likely to know, as were those in the 45 to 54 years age group, those who were in employment, and those who were engaged in home duties. Also more likely to know were those who were married compared to those who were single, those who lived in the more deprived areas of Ireland versus those in the least deprived. Sorry, the least deprived were more likely to know versus the most deprived. Those who were educated to degree level or higher, and low risk drinkers were more likely to know compared to hazardous drinkers, but it's important to note that non-drinkers were almost equally as unlikely to know of the link between alcohol and breast cancer. So very quick, what our paper concluded was that despite alcohol being classed as a class 1 carcinogen since 1988, there's a very poor level of awareness of that link between alcohol use and developing breast cancer. Just 1 in 5 of the population are aware. We could see there from the previous slides that women were slightly more likely to be aware, those in their middle age and those with higher educational levels. We also know that alcohol use is common among women. 3/4 of women drink, 1/4 of women drink in hazardous drinking patterns, and they're placing themselves at high risk of alcohol-related conditions, including breast cancer. So obviously the purpose of today's event is to talk about alcohol labelling, and in the process of researching the literature for this paper, most of the literature would have made recommendations of what can be done to raise awareness. And across the board, one of the key recommendations was alcohol labelling as the most effective way to inform consumers about alcohol-related harm. And I've just included a number of other findings from the literature. So we know, as well as informing consumers about the health risks associated with alcohol, labels are also effective in communicating information about the low-risk alcohol guidelines. And I've included just an image there of a paper that was published by my colleagues a couple of years ago about knowledge of what constitutes a standard drink and what are the low-risk drinking guidelines in Ireland. And that paper concluded that there's very low-level knowledge of what is a standard drink and what are the low-risk guidelines. So we know from the international literature that labels are a really good way of informing the consumer about these. Also from the literature, we know that labels motivate changes in alcohol use behaviours, and importantly, especially for breast cancer, is particularly among women, we're motivated by labels. I've included an image there of a book that anyone who works in the area will, for me, it's my Bible, but it's a book by Baber and colleagues, and it's the 3rd edition that was published this year. And basically the authors have gone through all of the literature, systematically gone through all of the literature to see what works and what doesn't work in reducing alcohol-related harm. And they have classified labelling as a good practice. So as Sheila already outlined, the Section 12 of the Public Health Alcohol Act stipulates that alcohol products should have information. I've listed them here. I don't think I'll go through them, but listing what should be on what is legislated for on the alcohol products. And it includes a specific warning informing the public of the direct link between alcohol and fatal cancers. And just to kind of further support for such a labelling is a snippet there from a paper that was published just a few weeks ago by Calnan and colleagues, showing support for evidence-based alcohol policy in Ireland. And I'm not sure if you can see it there, but there's very high support across the board, but particularly so for health warning labels. So for example, there women who took part in this representative sample of the population report 84% of women supported warning labels on alcohol products. So I suppose one of the purposes of our paper was to know who to target when we're looking to educate people of the harms associated with alcohol. And yes, we did kind of identify a number of groups, but I think we can conclusively say that across the board, there's very poor level of awareness. So obviously it's important to support and inform women because the risk of breast cancer from alcohol is sex specific, it's female breast cancer, but it's important to inform men too, so that they can support and advise family members and friends or any women in their lives. I think it's also important to understand drinking motivations that can be used then to inform effective public health messaging. So why do certain women continue, or people, anyone at all, continue to drink despite knowing the risks? We need a little bit more research into that. And what else influences awareness? How effective are social media campaigns? How effective is it to get advice from your health practitioner? How effective are education programs in communities and schools? I think the influence of the media is very important in this sphere because a lot of people are getting a lot of education, be it rightly or wrongly, through the media. And it's very important that the media are well informed and giving out the correct kind of message. One of the recommendations that we made in this paper, that given the amount of media coverage in recent weeks and months and years that alcohol has gotten through the process of the consultation process on labelling, people might be more aware of the risks associated with alcohol use. So that's another study that could be done. I think in light of the WHO recommendations that there's no safe level of alcohol use, a recommendation that we made from the paper was that our low risk drinking guidelines be revised. And as John said, I think it's a no-brainer that the alcohol labelling needs to be enacted as per our legislation. So thank you very much. That was very brief summary of that paper. I have done, it's available through open access at that link there. I've written a blog for the Institute of Alcohol Studies, just summarising the findings from the paper. And I've also done a 5-minute audio clip summarising the findings too. So you've no excuse not to read it. And here's my contact details. I'm happy to take any questions. Thank you very much.
Well, thank you very much indeed, Anne, for a very clear presentation. And I think 3 of the findings you outlined there make a compelling argument, don't they, for putting alcohol warning labels on bottles. First of all, that there's no doubt about the evidence that alcohol is a carcinogen. It causes cancers, including breast cancers, including at very low levels of alcohol consumption. Secondly, very few people, 1 in 5, appreciates that risk. And thirdly, it's a WHO best buy. So I think that's a very compelling argument you put forward there to emphasize the importance of labellings in this situation. So thank you very much indeed for that presentation. It's very clear, and we look forward to your addressing questions later on in the meeting, in the webinar. So thank you very much indeed, Anne, for that. Very clear. Our next presentation comes from Katharina Georgi, who is the CEO of FAIR, which is the Foundation for Alcohol Research and Education. And Katharina has joined us all the way virtually from Australia today. So thank you very much indeed for doing that, Katharina. Katharina is the CEO of this organisation, which is a charity, rather I think like Alcohol Action Ireland here in Australia, devoted to reducing alcohol harms and also research in the same area. Katharina previously worked within this organisation and has also worked in other national not-for-profit purpose-driven organisations. And she's going to talk to us about something that's been very important in Australia, which has been visible pregnancy health warnings for alcohol in Australia. And I think this could be a bit more appropriate presentation than here in Ireland, where we've one of the highest rates of alcohol consumption in pregnancy in the world and one of the highest rates of FASD. So I look forward very much to hearing your presentation, Katharina, and welcome to Ireland from Australia.
Thank you so much, Frank. I really appreciate it. And thanks so much for inviting me. Okay, how's that going? Can you guys see the screen? Wonderful. So my name's Kat, and as Frank said, I'm joining from Australia and from the Foundation for Alcohol Research and Education. I'm going to talk to you about visible health warnings on alcohol. The first thing I want to do, though, is to acknowledge the traditional owners of the land that I'm joining you all here from today, which is the lands of the Ngunnawal and Ngambri people, and to pay my respect to elders past and present. So, just really briefly about FARE, we are a lot like Alcohol Action in Ireland. So we aim to create an Australia that's free from alcohol harm. And so we do that through evidence-informed policy, through people-powered advocacy, and through health promotion programs. I'm going to chat to you about a mandatory pregnancy health warning. The reason why we were advocating for a mandatory pregnancy health warning is because alcohol consumption in pregnancy can lead to miscarriage, stillbirth, low birth weight, and, as Frank said, fetal alcohol spectrum disorder as well. So Australia has clear guidelines that say that alcohol shouldn't be consumed in pregnancy, but currently about a quarter of Australians aren't aware that exposure of alcohol can lead to harm to a developing baby. This risk is higher among young women, and also we estimate that there are about 75,000 alcohol-exposed pregnancies each year in Australia. So another reason for a mandatory pregnancy health warning is because, as Anne was saying, they work, they increase awareness, but for that to happen, they need to be visible. So what you can see here in that box is the label that we were advocating to be adopted, and the label that was being considered by the independent agency here that looks at labelling across Australia and New Zealand. What you see in those images on the other side of the screen is labels that are almost invisible. So you can barely see that there's a pregnancy label. And alcohol companies, seeing that pregnancy health warnings were going to be adopted, introduced voluntary labels to try and avoid having mandatory labels put in place. And they said that these labels that you see on the screen here to your right were sufficient, that people could see it, that it was all good, there's nothing to see here, everyone should move along now. So what happened was that this was a 20-year advocacy effort by people with FASD, their parents, their carers, communities. And what started with was an application to have a label introduced, firstly in 1996, which was then withdrawn, and then again in 2006. We had an independent government review recommend that a label be adopted, and that was 12 years ago now in 2011. Then what happened at that point was the alcohol industry was given 2 years to introduce an appropriate label on a voluntary basis. And that's because alcohol companies and their lobbyists had lobbied really hard to have a voluntary label applied. Later on, though, they found that the label wasn't being applied and that it was completely ineffective. So even 6 years down the track, it had only been applied to less than half of products. And so a decision was made to make the label mandatory, and that happened from 2018 onwards. It was at this point that the lobbying from alcohol companies really increased. And this is similar to what you're experiencing there now, in that the closer it gets to implementation, the more these companies and their lobby groups just want things to feel messy. So they do all they can to just make things feel mucky, make the evidence seem uncertain, make it seem really complicated for decision makers. So what we needed was, for a label change in Australia, the decision has to be made by all states and territories, plus the Australian government and the New Zealand government. So we needed a majority of those 8 votes across those jurisdictions. And what happened when it first went to vote was that it was deferred, and the decision was deferred for 3 months. And so at the end of the campaign, we had a 3-month period to flip these no's that you can see on the screen to yeses. We needed to flip at least 2 of those jurisdictions to get a majority of the votes. So what alcohol companies and their lobby groups did in fighting against the label was, initially they said, we don't need a label. And they said ridiculous things about it. Leading to harm. And I'm not going to repeat those things because we don't want to reinforce their myths. But at first it was, we don't need a label. Then when the label became mandatory, they said, sure, we support a label. Of course, everyone wants a label, just not this label. So they had a campaign running called Not This Label. They had alcohol lobby groups and alcohol companies reach out to decision makers saying, look, we want to do the right thing. It's just not this label. I'm going to unpack some of their messages a bit more. So the label that they were seeking is actually applied to each of these products. And I'm just going to give you a second to look for the label, because effectively when they were saying not this label, what they were asking for was a label that was invisible. The way they asked for it to decision makers, though, was they said, what we need is a transparent label. And so when we had these mock-ups created and we said, this is what alcohol companies are asking for, it really showed exactly what this muckiness was all about. And actually that alcohol companies and their lobby groups were just trying to do all they could to make sure that this label wasn't applied. So the industry opposition narrative went like this. So it went, we welcome mandatory labels. And the alcohol industry is deeply committed to warning pregnant mothers. We won't talk about how problematic that language is, of the dangers of drinking while pregnant. But we want a mandated label that's flexible and that's cost effective. So this was their narrative. Their narrative was, we're really reasonable. We just want this common sense thing. We just, this is about balancing. It's always about balancing. It's always about balancing industry interests and competition, etc. And these were the type of narratives that were coming out. This is coming out of the Alcohol Beverages Australia, which is a huge lobby group here that represents all of the alcohol industry groups. So they say pregnancy warnings are supported, but the cost would be $400 million. Now I lost track at how many numbers they used to refer to the cost, but I can tell you that all of the numbers were very far from the 10 independent cost analysis that the government and independent agencies had undertaken. And it was completely ridiculous. They then started making claims that there would be a loss of 6,500 jobs. This is now mandated in Australia. As of July, it has to be on every single product, but they've been implementing it over the last 3 years. And I can tell you that we haven't heard anything about job losses or anything about costs since this happened. These numbers had no basis and no foundation, but this was the main narrative that they were going for. And then they were saying that if you're going to apply colours, which is the thing that makes the label visible, then, it's just going to completely decimate us. And so this was their main argument here. So when they said that having these 3 colours would cost $400 million, what we said was, we said nothing on cost. And this was something that we spoke a lot to the sector about as we worked across many hundred organisations to create this change. Because what happens when you're representing a public health organisation and you have the facts and you have the evidence is you go, but it's not true. None of this is founded in truth, and we need to point out that it's not true. But by pointing out that it's not true, then in the media, we have to say what they're saying. And so by saying that $400 million is ridiculous, we have to say the number 400 million. And so the headline and the narrative becomes about the 4 million. So what we had to do was keep bringing it back to the thing that alcohol companies and their lobby groups don't want to talk about. And it's the things that John was talking about before. So when I was asked in interviews about this, I was asked, you know, the industry said that it would ruin jobs and we're in the peak of COVID. And I would turn around and I would say, well, that's completely inflated. And what the
So, Katerina, I think we seem to have lost Katerina at the moment. The line has just gone dead on us. It's an absolutely fascinating discussion that has been going on there, and hopefully Katerina will be able to come back in again to us in a couple of minutes. Frank, maybe though, if we don't seem to get Katerina coming back, we might be able to move on to our panel discussion, but hopefully she will come in.
Yeah, that'll be fine, I think.
Actually, I think I hear Katerina coming in again.
Great.
I'm very sorry.
You're good, you're good. You're back with us. Fire ahead there, fire ahead.
Okay. I'll just share my screen again. Bear with me, apologies. So when they were talking about small business, what we pointed out was that the lobby groups that were saying this actually largely represented the big guys. So they represented these huge companies. And another thing we did was we spoke to some small wineries and small producers who were actually getting really annoyed at how vocal these big companies were and how bad it was making them look. And they started coming out in the media and saying that they wanted these labels and that they just wanted it implemented and they just wanted it done. The next thing that we did then was we really tried to hone in on our message. And we did a lot of work and a lot of testing on this, on the values-based messaging that we used on the campaign. And so we used messaging that really focused on why this was important. And this narrative was everywhere. And this was the messaging that we used when we spoke in the media. So we spoke about how for families, the most important thing is the health and well-being of our children. And that's why it matters to all of us that we have access to clear information, which is very similar to what you're saying tonight about the right to know. Then we spoke about the urgency, the need for change. So food ministers will soon meet to decide on this. And what we need to make sure is that the label is visible, it's clear, it's the one that's being put forward, and that any watering down to this will really mean that it hurts our kids, it hurts our families, it hurts our communities. So the approach that we used was a values-based messaging approach where we focused on the vision, so the world we wanted to see, then we focused on the barrier, and then we reinforced the need for immediate action and the opportunity that decision makers had before them. There were lots of different ways that we communicated this message, but one of the ways was through amplifying the stories of people with lived experience. I'll share a link to these videos because after my video's already dropped out today, I'm probably not going to try and play a film now. But this is Jessica. Jessica at the time was 32. Jessica has FASD, and we had people like Jessica really wanting to share their stories. So Jessica and mums like Nikki and others all shared their stories of what it was like to have FASD or live with FASD and why they thought visible health warnings were really important. I think all of these things really reinforce that we put out the messages that alcohol companies didn't want to put out. The reason why they talk about jobs and the reason why they talk about money is because then it the narrative that plays out is using those extrinsic values, which we know are really difficult then to argue on, and we know from the evidence don't invoke that compassion to change. And so we focused on what the harm is, who the people are affected, and what the real life impacts are of this change. What we did was we built a really broad coalition. So we had 4,000 community leaders and 180 organisations join the campaign. And whenever signatures were added, they were added to a website so that people could see that they were there. And we tried to get as broad a group of people as we could. In each of the jurisdictions where we had to move a different decision maker, we worked out who they listened to, and we tried to get those people to really draw attention to this. I think this is something that's really critical now. It's great, so great to hear that your health minister is so committed to this, and them just continuing to get letters across their desks talking about how important this is, how much of a difference it will make, and how much people back them in, helps to give them the confidence to continue with this reform. So we had one health minister say that they'd never received more correspondence on any issue in their time as a health minister, because we were just working with community groups and people to keep raising this issue. And it was about having lots of diverse voices raise this as well in the media. So we had social justice commissioners, as I said, a winemaker, the former Governor General, all come out and talk about why this was really important. I just wanted to show also an example of some messaging that we used at different times. So at one point, when the ministers decided that they were actually going to delay introducing the label, they wanted to go away and have a think about it for 3 months. And this was the point when they were meant to just introduce it. We had to decide how we would respond. And there were lots of people who were really angry and really upset. And I totally understand that and respect that, because when you see what John sees every day, it's hard not to be angry and upset. And when you hear the stories that we hear every day. What we did on this day was we came out and we created a video for supporters and people in the community who'd been advocating for change. And we just said, we know at this point it feels really disappointing, but we're going to come together and we're going to keep advocating for change because we know how important this is. And once the ministers did decide to implement this label, we really focused on the fact that this was a decision that prioritised community safety and health. And so they were making a decision that history would look upon kindly, a decision that would actually have a positive impact on future generations. And so some of the principles that we adopted was using values to persuade. I know when it says not facts, what I'm saying here isn't that facts aren't important. Facts and evidence are critically important. And I can send you through folders and folders of briefs, every variation of briefs that we provided on, debunking myths, arguments, etc. But the public narrative was really around values. It was around kids, it was around health, because it's harder for the industry to argue around that. We focused on external factors rather than individuals. So unfortunately, what happens because of this framing by alcohol companies over many years on individual responsibility is that people turn around and they go, well, shouldn't people know that? And things like that. And so we spoke a lot about how there's lots of misinformation out there, and this really just helps to clarify that. We spoke about it from being part of the community, and that was really important too, standing alongside everyone who was advocating for the change. We asked for more, not less. So we spoke about this as being one part, as you guys are too. Actually with what we're seeing when it comes to harm, we should be doing everything we can possibly do. We really stuck to our story, and as hard as it was, we just didn't play into their narrative. So it's really hard when they're just lying, and they do, and you guys know this and you see it, to not talk about that. But by talking about that, it gave them the headlines that they wanted. Our job is to advocate for something that's really clear. Their job is to make things feel really murky and messy. And they're very good at that. That's their main game as merchants of doubt. And we spoke about, strengthening agency and, highlighting through having people with FASD share their stories, that this was about strength. This was about strength in awareness, strength in acknowledging that FASD existed, strength in coming together as a community and saying this was important. In the real world, it's really hard to do these things, but I have no doubt that both working alongside a really broad community, consistently saying the same things and using that values-based messaging approach was really important. I just want to show you what it looks like now on the shelf. So there's a requirement in Australia for the label to be applied to outer packaging. So if it's a carton of beer, it has to be applied to the carton. It also has to be applied to the 6-pack or 4-pack packaging. And then it also has to be applied to the can or the bottle as well, depending on what it is. So you can see the example of how it is applied. And there are really clear specifications on visibility. So it has to be, it can't be upside down. It can't be hidden within designs, and on size as well, which is why you're seeing these really large visible labels there on these products, which is really important so that people see them. Okay, so that's it from me. Thank you so much for hearing, and thank you also for persevering through those technical difficulties as well.
Thank you very much indeed, Katharina, for your presentation and for sharing your experience of how they overcame the obstacles in Australia. And it was interesting looking at your timeline. It's not much different than our timeline. Everything has taken so long. There has been so much vocal industry lobbying and advocacy. And interestingly, I mean, it really is the case, I think, of David and Goliath, isn't it? I mean, organizations like ours are really struggling against massive transnational corporations. I'm very impressed at how you have involved the voice of victims or patients, because I think that's the voice that's less well heard than it should be, certainly in Ireland, and I think in other jurisdictions as well. And I think part of that is the stigma, and part of it is the industry message that the people who are drinking heavily are people who are just not behaving properly. The good people drink well and the bad people don't drink well, and that's their message, I think, really consistently. So I think it's brilliant to see you're making those voices heard. I think that's enormously powerful. So thank you very much indeed now, Katharina. No, we're not going to ask Katharina any questions, but we're going to, on her own, as I said, we're going to have a panel discussion now. And with our panel discussion, we're going to invite Katie Dunphy from the HSE Alcohol Programme, and also Rachel Murray, who is Director of Advocacy and External Affairs in the Irish Cancer Society. So I'm going to invite you all to the virtual podium, and we're happy to take questions. There is a question there I see from Marion Rickard, which we could take while we're starting, and then we have a couple of presentations we might discuss as well. Questions we might discuss as well. So Marion Rickard has a question. She said, she comments that it's very surprising that the wineries were in favour of labelling, as Italian wine companies are criticising Ireland in a big way for what they see will be a disastrous impact on their companies, and asking if you could comment, please, Katharina.
Yeah, I should clarify that the industry groups, so the wine lobby group in Australia was opposed, all the large industry groups were opposed. But whenever we're advocating for change, we try to find a wedge somewhere. And the wedge was that there were a couple of small producers who weren't affiliated with those large lobby groups who were supportive. Very small number, but just as we know with media, if one of them comes out and says something, then it looks like a larger group of people feel that way. So definitely the wine industry group were the ones that they wheeled out the most, because they could talk about vineyards and mum and dad wineries and all of those types of things that they like people to have pictures of. But it just took one small winery to come out and say, we want to do it. And then the media kept using that.
Yeah, it's interesting. There was in the lead up to the public health alcohol bill, there was again that emphasis on the alcohol, the role of the alcohol industry in communities, small shops, and so on and so forth, the kind of making it local. So it was very powerful, I think, that you heard from individual wineries coming out like that. I'm very impressed with that. Well done. Are there any other questions there, Jennifer? that we need to address before we maybe open it up? We have a couple of
I think
topics.
we can move on to the, we do have a couple of topics there, so we can move on to the moment. Yeah, thanks.
Thanks very much. So the other couple of topics we thought we'd ask those of you particularly on the panel is, will Ireland's progress in relation to labelling encourage other jurisdictions to follow suit? So I'd ask for the panelists to comment on that, if they've any thoughts in relation to that. I can't quite see the panelists. I don't know if you can, Jennifer, maybe to help me out in relation to that.
Kate has her hand up there. Kate from the HSE, I think, has her hand up.
Great.
Yeah.
I know in relation to that particular topic, I'm of the belief that Norway have included this in their alcohol strategy of late. So I think they're following suit. And as mentioned by, I think, 2 or 3 of the panel or the speakers already, it's part of the beating cancer part of the plan. So I think it's inevitable that it will happen in a broader way across Europe, but I do know Norway are close enough behind us as well in this.
Okay. Thank you very much indeed. It's interesting, the alcohol industry in their submission this week to the WTO was saying that one of their suggestions was that we don't implement labelling as Ireland alone, but we should do it across the whole EU together. And of course, that's just a delaying tactic. Yes. But I do believe that once it happens here, a lot of other jurisdictions, perhaps not the 9 who responded to the WTO or EC, but I think that that 9, the other countries will say, do you know, honestly, we're crazy in not having labels. It's such an anomaly. And
Rachel has a hand up there too from the Cancer Society.
Yeah, Rachel, I'd love to hear from you. Please.
Yeah, no, I was just going to, I suppose, reflect on some of the things that we've heard today from Katerina. And sadly, in the Cancer Society, this isn't our first rodeo when it comes to kind of industry tactics. And we were very much part of the playbook that the tobacco industry used when it tried to fight legislation. I know that that's, not an issue that they want us to focus on, and they would differentiate their industry from the tobacco industry. But I think that we have learnings as well on the public health side, and the central issue for us is that public health has to trump commercial interests, and I think that was recognised at a European level. And I think that, just in respect to what Katie is saying and other countries watching what Ireland is doing, Ireland has been one of the leaders when it comes to public health and legislating to protect the needs and the health of people who live here. And I also think that, when we look at kind of our children, our grandchildren, we provide palliative care for cancer patients who are sadly passing away. And the one thing that they really want is to spend more time with their family. Without doubt, that is what they say to us most. And I think that, by implementing legislation like this, it actually does give people, more of an opportunity to live life well. And I don't think there's no argument against that.
Okay, thank you very much indeed. Very strong argument. I think entirely correct, Rachel. Thank you very much indeed. I see there's another question from Paddy Creedon, who is a member of the board of Alcohol Action Ireland. And Paddy was wondering whether or not Australia and FARE got support from healthcare funders. And of course, this would, I think, reflects the fact that the cost of alcohol is unsustainable. The cost of alcohol harms is unsustainable to society. So I wonder, Katerina, can we ask you, did you get support from your government or Department of Health or funders, please?
For advocacy?
Yes.
Is that no, not for the advocacy. So across the various organisations that were working on this, to do things like buy full page ads, we all kind of chipped in. And that was the way that we were able to progress some of these actions. But otherwise, it was just lots of phone calls and lots of people. I should also acknowledge that the work that you've all done to get the changes, when I saw Sheila's slides at the beginning and the implementation of the measures today, and then pushing to get these other ones along, we're all looking to this because it really helps to point to our government and say, we should be doing what Ireland's doing in these spaces. So thank you for that, because it helps to push other governments along.
Okay, thank you very much indeed, Katharina. And it is interesting. I do think that there will be a metastatic effect. I think there will be a spread effect of healthy labelling from Ireland, from Australia, and ours are a bit broader, I know, than yours. But yours is it's a very clear message, isn't it, that you have on your bottle? You know, lifelong harm. It's like that's at least doesn't leave people in doubt, does it?
Yes, but over to more labelling as well down the track.
Yeah.
I can see that Sheila's hands up as well.
Yeah, Sheila, please.
Yeah, I was just wondering, you know, that wedge kind of thing, and certainly we were able to, you know, use that in some other things, like for example around MEP, you would have had sections of the alcohol industry actually were in favour of MEP. So, you know, the Off-Licence Association, for example, would have come out and said that they were in favour of it because they saw the unfair competition that they were up against, say, for example, supermarkets as a thing there. We haven't to date really found a wedge for that cancer issue, because I think basically nobody really wants to say that their product is carcinogenic. But one thing that does occur to me is, you know, we have seen with the tobacco industry, people actually taking cases against tobacco companies for, you know, for causing harm to individuals from that, and possibly the industry might themselves really reflect and think, do you know what, we'll be sued someday for massive damages over the basis of the harms that our product has caused, and maybe we should be agreeing that it's better to have a fairly modest label on our product telling people about it than running the risk of being sued at some stage. That's just a thought that occurs to me. Who knows, you know, whether the industry are thinking like that or not, but just on that wedge kind of thing of what potentially might be something that could be useful.
I think there's something in that, Sheila, just with regard to kind of withholding kind of health information as well. Obviously, there has been kind of a public narrative around Irish patients particularly wanting more information and wondering who holds that information and the sharing of that information. We all know, everybody on this call knows that alcohol causes cancer, and we as citizens, shouldn't we be informed of that risk so that when we consume that product that we're aware of it. And I also think that, you know, the alcohol industry can sometimes come across as being kind of, you know, like a pseudo friend. You know, its brand is you know, quite a accessible brand, and the reality is that they are actually lobbying against the people who consume their product and pay their shareholders, and they are not their friend. They want them to continue to consume alcohol, and they want them to continue to consume it in significant amounts.
Yeah, I think that's a very fair question. Their conflict of interest is absolutely enormous. I think sometimes the case may be difficult to prove. It may be difficult to prove that your breast cancer or your colon cancer or your esophageal cancer is related to alcohol, but it's not difficult to prove that your alcohol-related liver disease or your alcohol-related liver tumor is related to alcohol. I think they're much more like lung cancer, for instance, in the scenario of tobacco 30 or 40 years ago. But it does surprise me that there's been no interest in the legal case around this. And I think, again, some of it comes back to stigma. You know, the fact that alcohol is associated with an enormous stigma, much greater than with many other illnesses, regrettably. Are there any more comments there or questions? I might just ask. I might just roll another question into play. Are there other health areas that should be included on the labels, do people think? Is there anything else that we should be highlighting in the labels? One of the things that has struck me that we should perhaps think about is the risk of people dying related to the event of drinking. As we know, about 1 in 3 or 1 in 4 deaths internationally related to alcohol is related to the event of drinking, people being involved in violence or a road accident or incident, taking their own lives, etc. So I wonder, does injuries, I wonder, do people think that there are any other issues that should be perhaps included in some of the labels, or whether the label should be just those 3 all the time, or whether there should be rotating labels, for instance, around the big and very harmful consequences of alcohol, and perhaps whether we should have a warning that, you know, drinking alcohol harmfully may damage your children or other members of your family or your loved ones.
Katie has her hand up there.
Katie has her hand up, yes. Katie, would you like to make a comment?
Yes, I would. I think when alcohol is a contributor to about 200 diseases, you could nearly take your pick. You could take mental health, you could think about heart disease, the acquired brain injury that alcohol can cause. I mean, there are so many different things that alcohol can impact for an individual and their health and their well-being, and that's not even taking into the community side or harm to others. I mean, you could cherry pick a lot of them, but I also agree that having some of the warnings on a rotational basis, because I do think that there is a lot of literature and support that would show that people kind of tune out if it's the same message all the time, and having that on rotation would be quite important. That's it.
Thank you very much indeed. Thank you very much indeed, Katie. Are there any other comments in relation to that? And then another topic that I think is particularly interesting is, does health information labeling have value beyond providing consumers with knowledge? My own prejudice is, particularly warnings, they actually are part of identifying alcohol as a harmful product rather than a simple economic product as was previously viewed. And it's a health related issue, which of course underpins entirely the Public Health Alcohol Act. So I do think that that's my own prejudice and bias. I'm interested to hear what other people say. And I see Sheila, I think you have your hand up there. You might wish to comment.
I have. It's possible that I planted that question because I came across a piece of research that I found very, very interesting, that basically said that when people were exposed to health warning labelling, that not only did it increase their awareness simply of the fact of the risk that was there, but it also, if you like, it made them more open to the idea of the other policy measures that are actually needed to be put in place to reduce the harms that are there. So things like taxation or restrictions in advertising, which are a restriction. Nobody wants to pay more tax. That, like myself included, nobody likes the idea of paying more for something. But you can be a bit more open to the idea when you actually realize this is a harmful product, and as you were saying there. And I think that it informs the wider policy framework and the wider policy understanding when we have the sort of thing. We certainly know, and Frank, you would know greatly when you're up against the industry and their arguments around that, and you're having to persuade a media to take on board the ideas that are there. So much of media's ideas, like our own, like everybody's, we're very influenced by the industry's message because we're surrounded by it. We're drowning in it. We see 115 million euros worth of alcohol advertising in Ireland alone. So it is no wonder that it is hard for us sometimes to say, oh, I'd be okay about MEP or whatever at the same time. I think actually having the labels in would make that argument a bit easier for us in years to come.
Yeah, I think that's a very fair point, Sheila. Thank you very much indeed. I think it is also worth thinking about when we think about money and we think about the industry. I mean, the biggest single employer in the alcohol industry in Ireland is, and this may surprise you unless you reflect on it, is the health service. Because about 11%, as Sheila said in her earlier slide, of the government spending on health is directly related to alcohol. And, that probably, so that's an enormous industry, far bigger than the alcohol industry here, the alcohol production industry here in Ireland. And Ewan McKinney, when he was with our Alcohol Action Ireland last year, produced a great report on the market in Ireland, and he estimated that for every standard drink in Ireland, that's 10 grams of alcohol, about half a pint of beer, an eighth of a glass, a bottle of wine. The Exchequer had to underwrite that by €1.16 per standard drink in terms of the downstream costs of alcohol. And that's using the very conservative metrics of what the costs in Ireland are. So, we're in a funny situation. I think the biggest employer, the biggest single employer within the alcohol related industry is the health service. It's funny when you think of it like that, I think. Are there any final comments before we wrap up? We're just coming up to the end.
Frank, I just think there is a question in the chat which was directed, I think, to Katerina, which was about It's from Helen, and she commends your excellent and effective principles using values to persuade, not facts, blame external factors, not individuals. And she asks, how did you arrive at these?
Yeah, it's an excellent question, Helen. It's the values-based messaging principles are largely based on something called the Common Cause Framework, which you can look up. And then we've adapted a bunch of resources around that. So for people who are working in this space, feel free to reach out, and I'm really happy to share those things. But also just thinking about some of the things we say, you know, using words like drinkers or consume or those types of things really reinforce the messages of the industry. So really making sure that when you're talking about an actor, we're talking about these alcohol companies and their lobbyists as the actors who are driving this harm. Yeah, I just think about that. And I just want to say something really random on my way out, which is I think that John should buy shares, very small number of shares, in one of these alcohol companies who are trying to stop what's going on here, and go to their shareholder meeting and ask a question about what you're seeing in your hospitals. Because I just think that they don't hear enough of this, and that these decisions aren't made in isolation. They're made by people sitting at board tables who are actively trying to stop this. And I would love to see John ask these questions directly of them in their forums. So yeah, just wanted to volunteer you for that.
Yeah, well, yeah. I don't know if I had all the money in the world, but I want to invest in that. But you know, that's the thing. I think it's a very valid reason why I put up all that kind of graphic nature in the presentation, and try to hammer it home of what the actual. It's all very well to talk about harm, but when you see it, or you see all the things we see people with irreversible brain injury, you know, even babies with fetal alcohol, just all these things that we see, until you actually visualize the gravity of it, or experience it in your own family. But if you're lucky enough not to see that, but then when you see what we're talking about, then you go, wow, that's really, it hits home, you know. But yeah, I really enjoyed your presentation as well, and we'll let you know if we fund anything or get at those tables. If we were invited, it would be wonderful. I mean, there is an argument certainly that, you know, that the tobacco industry is funding healthcare for tobacco-related harms. Should the alcohol Diageo, should they sort of proportion of their profits be paid into? We have no funding for an alcohol team. We've no funding for any additional support, and the cost, there is really well evidence-based cost effectiveness of putting money into alcohol services to try and reduce the admissions and length of stays and presentations, and it all works. It's just not funded. So yeah, they're great points.
Thank you very much indeed, John. I think that's very fair comments. I just give you a sneak preview. The European Association for the Study of the Liver is producing an alcohol policy document, and one of its recommendations is that there should be a levy on the alcohol industry to recoup the costs of alcohol harms. And I think that's something that we should address as we go forward, is actually saying the industry needs to pay for those downstream costs. They're responsible for it. And they should be asked to pay up. I think it would wipe the smile off their faces very quickly, really, to be perfectly honest with you. Are there any other comments? Okay, I might just wrap it up now. I'd like to thank first of all, I'd like to thank you all for coming to the webinar and for contributing, those people who contributed and asked questions and contributed to the chat. I'd especially like to thank the team from Alcohol Action Ireland, who organised the meeting, Sheila, Hannah and Jennifer. And I'd like to thank very much the speakers who gave us outstanding presentations there along the three areas of the of labelling: alcohol, cancer, and FASD. So I'd like to thank you all very much. It was wonderful. I'm sorry Katrina got cut off, but you did come halfway around the world, so we have to be very understanding of that. And I'm sorry about the technical issues, Katrina. And I wish you all very well, and we'll conclude this webinar there. Sheila, do you want to add any final words?
I just want to say thank you very much to yourself, Frank, for chairing us there and and keeping us all to a very good time. Thank you.
Okay, thank you all very much now. All right, bye-bye.
Everyone.